meetings. We save the best committee for last, right?
All right. I'm going to advise the attendees that this meeting is being recorded. So anything said verbally, anything viewed via webcam, or anything typed in the chat can become part of the recording that's posted publicly. If you're on the phone only, you may need to hit *6 to unmute yourself. And please mute when not speaking. Thank you. Go ahead, Dr. Woolridge.
Thank you, Shelley. Yeah, this is Dale Woolridge. I'll be chairing this meeting for PACES today, and I would like to call it to order. It is now 1:30 p.m. and Adam or Shelley, would you be willing to do the roll call for us?
Sure. Let's see. Heather Berner, did you come in, Heather? No? Okay. Dr. Woolridge, you're here. RJ emailed me, said he's not going to make it. Jordana Carpenter, I saw you come in. You're still here.
Yes, I'm here.
Excellent. Tony, I see you there. Thanks for being here. Mickey, I saw you come in. Thank you.
Yes, I'm here.
All right. Heather Miller, I saw you come in. You still here?
Yes, I'm still here. Yes, I'm here. Thank you.
Miss Evans, Jackie Evans. Oh, there's Heather. We just caught you. Okay. How you doing, Heather? Nice to have you. Tony Huma. Ann, I just saw you pop up. Thanks.
I'm here.
Chris Ramos isn't joining us. Debbie Johnson, I think I saw you come in, right?
Yeah, I'm here.
Awesome. And Dr. Ziedler, I saw you come in.
Yep.
We have quorum, sir.
Okay, thank you very much. So I'm going to step us to item number 3 in our agenda. That's the chairman's report. I would move that we review our attendance report. Can I have a second?
Yes, Jordana.
Okay, great. Shelley or Adam, would you be willing to show that on screen?
Aren't I? I'm sorry. Display what? Were you asking for the agenda?
Oh no. Do you want to show the attendance report? That was attachment 3A.
Oh, I don't have that.
And as you all know, PACES is not a statutory committee, but we do have a defined committee membership requiring quorum. So we are very pleased and happy for those who are on the committee and attend regularly. If you do miss a meeting, we'll reach to you. If it's more than 2 meetings, we'll reach to obviously see if you can continue to be an active participant. And if we don't have the, I don't think we have to show that or to display that, or I have it on my screen if I knew how to share using this platform. Oh, here we go.
There you go. Sorry about that. I wasn't ready with that in the holster. I have to go find it.
No, that's quite all right. I'm just less familiar with my well, my apologies, because I am not seeing how to display here. So
I think I'm just about to get there. Sorry about that, everyone. Here is the attendance record, attachment 3A. Is that what you were looking for, Dr. Woolridge?
yeah, and just the commentary that I think it's just a formal standard presentation in that portion of the agenda that we would encourage attendance and let us know in advance if you cannot, because of our defined committee, we want to have as much active participation as possible, and we do appreciate that from everybody. So
okay.
I'll step us to our next item on the chairman's report. We have one soon-to-be vacancy, and that's our currently practicing paramedic position on our committee. RJ Dieters is stepping down. He is going into retirement. And his announcement email, I know RJ through our PACES work, but did not know him as well personally, but was surprised to see that he has 46 years of active EMS career. He's going to be retiring in Minnesota, though he informed me the land of actually more than 11,000 lakes. And he calls it God's country. I did tease him that he is moving there in April as opposed to January, February, because he won't be cold. But RJ was not able to make it today, but if you have a chance to reach out to him and thank him for his help, he'll be sorely missed. And with that vacancy, we'll be trying to recruit another currently practicing paramedic to fill that position. We do have a new council member, Heather Berner. Thank you so much, Heather. Appreciate you joining us. Heather is filling our position as a registered nurse with emergency experience. Heather, would you be willing to give us a couple of sentences about you and introduce yourself?
Sure. Hi, everyone. I'm Heather Berner. I have been a nurse for about 21 years, and my last role in the nursing world was at Banner Thunderbird in the Pediatric ER. So now I am currently still a nurse, but I run a nonprofit for Safe Haven, and I run the National Safe Haven Alliance and the Arizona Safe Haven program. So I wear a lot of different hats, and I'm honored to be able to join. So thank you for having me.
Thank you, Heather. I'll step us to item number 4A to start our department updates.
Real quick, Dr. Woolridge, I think someone has their hand up.
Oh, go
Ray?
ahead.
Yeah, Dr. Woolridge, so sorry to interrupt you. I didn't mean to do that. I saw that you were talking right now about the vacancy. How do you apply for that? You have to fill out an application for that?
If you're interested, I'll give you my contact information, and I would go back and forth with you directly.
Perfect. That sounds great.
Generally, it's a letter of interest and a CV or resume.
Excellent. Sounds great.
Yeah, thanks for that. Appreciate that. Let me get with you offline.
No problem.
Wonderful. And then Shelley, as far as parliamentary processing, do we need to make a motion for that at all, or is it occur between meetings and then we readdress it at next meeting?
No, getting the members is, you can do it anytime.
Okay. All right. Great. Okay. I appreciate your interest. Thank you so much.
Would you like to move to the Bureau report, sir?
Please.
All right. Good afternoon, Dr. Woolridge and members of the committee. This is Rachel Garcia with the Bureau of EMS and Trauma System. We wanted to provide a few brief updates on the status of the state emergency declaration related to COVID-19. As you all know, over the last couple years, there have been quite a few waivers and emergency measures in effect. And as we wind down and the pandemic metrics are trending in the right direction, we expect that the end of that emergency declaration will be in the coming weeks, if not the coming days. We don't have an exact date to share with the committee today. However, we wanted to share a few things that will be sunsetted when the emergency declaration ends in the recent days ahead. One is crisis standards of care, which was activated in 2020. As the emergency declaration winds down, crisis standards of care will be deactivated, and that will include many of the protocols and other things that were in place related to contingency and crisis standards of care measures. The enhanced surveillance advisory is also expected to sunset, which currently requires mandatory reporting from a number of entities. The executive order that has implemented the Arizona surge line will be sunsetted, and that will cause the surge line to be transitioning in the coming weeks. More information to come on that one. Other things to keep a lookout for will be communications from the Bureau of EMS and Trauma System on the emergency measure related to EMCTs being authorized to provide vaccinations and viral testing. At the end of the emergency declaration, all levels of EMCTs will no longer be able to administer vaccinations and testing. Additionally, related to waivers that currently allow temporary licensing or licensure for professionals, there is some legislation that is making its way through the House and Senate right now that would extend temporary professional licenses through at least the end of the calendar year, I believe. So there are a number of things going on to prepare for the end of this emergency declaration, and we wanted to make sure that we are sharing that information with you all to begin preparing and planning for what lies ahead. If you've not done so already, please subscribe to our Gov Delivery updates. That is the primary method of communication that the Bureau of EMS and Trauma uses to be able to push information out to stakeholders. I will now transition to introducing one of our new staff members, Antonia Gerard. I'm not sure if she's on the line, but she is our new rate analyst working for the CON and rates program within the Bureau. We're very fortunate to have her. If you haven't heard already, she comes to the Bureau with quite a bit of financial and accounting background experience. So thank you, Antonia. We look forward to introducing you to more stakeholders. I'll pass it over to you next, Adam.
Thanks. Okay, so under A, letter I, the Adverse Childhood Experiences Action Plan, to meet the goal of this ACE plan, the Bureau has developed an online and interactive training tool for EMS agencies and individuals that can be found on our Bureau's education webpage. The goal of that is threefold: to reduce the number of adverse childhood events. The second is to understand the data that's showing us as poor performing in that area. Arizona is in last place regarding adverse childhood events. And hopefully with that information, we would like to mitigate the number of outcomes associated with that. And so that's something we want to make sure that we get out there. Regarding the Title V block grant, which supports the EMSD activities, ADHS's Bureau of Women and Children's Health is currently conducting a series of annual visioning meetings for the Title V Maternal and Child Health Block Grant. The purpose of these meetings is to review the current needs, pause and reflect on what we've accomplished so far, and have a look ahead, develop a 2023 Title V action plan. If there's any further questions about that, I'll have to direct that to Allison Lucas, and I believe she's out of the office for the remainder of the week. Lastly, the new Opioid Dashboard is live, and that is a fantastic one-stop resource for all parties that have anything to do with opioids, whether you might be a user or a provider. There's links for everybody on that website, and you can see it adhs.gov/opioid. And so I'd encourage you to take a look around that, and it is a very, very good resource. Lastly, the NEDARC EMS survey. NEDARC is our data agency within the EIC that helps manage our data. And we're running our yearly survey. We're about 2 weeks out from closing it out, and we've gotten a pretty good response rate. We're above last year's numbers, and we still have a few weeks to go. That's very encouraging for us. Every district, or every region of the state has represented themselves for the most part with great participation. So we're excited about that. I'm just kind of moving along here, so I apologize. Under number 5, updates. Unless anybody had any questions under section 4, anybody have anything for me under section 4? The ACE plan, block grant, opioid dashboard.
Adam, your mic is breaking up a bit. I was able to understand most of that. I hope everybody else was. I don't know if there's a fix that you might have.
Okay, let me know if that's better.
That's a whole lot better. Yes.
Okay. All right. If there was any questions in the Bureau report, direct them to me. I'll put my name and email in the chat.
Did anyone have any problems with the mic? Do they need anything repeated? Please shout out.
Yeah, please do. I apologize. This is a bit challenging trying to go back and forth, so let me know if you can't hear me. Okay, under section 5 updates, Chris Ramos has asked me to give updates on his behalf of the Education Committee, which occurred this morning. And they did approve a product from us, or at least our work group, naloxone training slides, which we've been kind of developing since late last year, that have been approved. They also approved maternal a slide set that's oriented towards maternal resuscitation that we can take a look at if you guys would like, as well as we discussed the result of a statewide survey regarding our workforce assessment needs that was discussed in the Education Committee earlier today. If anybody has any questions that wants to follow up, please ask. Okay, I think if it's all right with you, Dr. Woolridge, you're going to move on to discussion and action items.
Let's move to action items. Thank you, Adam. And anybody, if there's any questions about the former agenda points, please holler out. So our first agenda item, I want to make a motion. We're going to a motion to review our PACES minutes from November. And if Adam or Shelley, you'd be willing to show those and share those on a screen so we can review them. I think first for processing, I need someone, I would like a motion to review. Can I have a second?
This is Jordana Carpenter. I will second.
Thank you, Jordana.
Do you already have the motion, Dr. Woolridge?
Yeah, I kind of cheated and did my own motion. Jordana seconded me, so I think we're okay. Thank you. Okay, and as Adam scrolling through the minutes, please review.
Hello, this is Tony Huma. I just got on the call, so I'm here.
Hi, Tony. Welcome.
Thanks, Tony.
As you're reviewing, be prepared to comment on whether or not you would like to have any edits or addendums to these minutes.
Is there anything anybody specifically would like to see?
Any comments or edits from the group? If not, I would ask someone on the phone to motion that we approve them and need a second.
This is Tony Kierzan. I'll make a motion to approve.
It's Zeidler. I'll second.
Thank you very much. And then we're going to vote. For those of you, please use your mics. For those of you who vote to approve, say aye.
Aye. Aye.
Hi.
Aye.
Aye.
Anyone in opposition, say nay.
I didn't turn my mic off or on soon enough. Aye.
Okay, good. And anybody abstaining? Okay, we have approved our minutes. Thank you very much. Okay, Adam, if you want to display the Narcan slide set.
Sure.
Item 6B, discuss, amend, approve educational resources developed by naloxone for pediatric patient work group. Do I have a motion to review in a second, please?
This is Ann. I motion to review.
Thank you, Ann. Second?
This is Tony. I second.
Thank you, Tony. Okay. I expect everybody in the group, or most of us in the group, have seen these. This is the slide set that we've helped to develop and essentially process through the Education Committee. Earlier today, the Education Committee met and approved this slide set as an educational tool to be included in the educational page at Department of Health. I think I was very happy with the product. I think I thank everybody for all the work that they put into this. And as we review it, I will next ask for PACES to vote on approving or not approving. And Adam, if you want, you can scroll a little faster and then just anybody shout out if you want to go back. So as you're reviewing, I guess I can do some commentary. The intent was to try to give credence and education to the community to kind of avoid this pretense of not necessarily wanting to treat pediatric patients or being more apprehensive about it. So the education stemmed on the fact that, you know, kids can overdose anyways. All the kids can overdose also, and that it is an appropriate medicine and a safe medication. So the pretense was to give some supporting data to that, national data supporting the effort to dose even in pediatric patients. Okay. So information is on pediatric dosing for the paramedic if they're going to aliquot their own volume versus the auto injectors advocating that irrespective of weight-based dosing, that the outcome is better if we give it. Okay. Do we have any comments from the group about the slide set?
I reviewed them before this meeting. Oh, sorry. I thought they looked great.
Thank you, Heather.
Thank you, Heather.
Yeah, agreed. They're very good.
I would like us to next vote on whether or not PACES is going to approve these. Can I have a motion and a second for that?
Ms. Jordana, I'll motion.
Thank you, Jordana.
This is Ann, I second.
Thank you, Ann. Okay, for those of you who vote to approve the naloxone slide set for department and bureau educational purposes, say aye.
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 Hi.
Anyone in opposition, say nay. Anyone abstaining? Okay, so the naloxone in pediatric population slide set educational tool has been approved. Thank you, everybody.
All right.
Item number C.
Gail and Adam.
Yes, Shelley.
Gail, this is Gail. Thank
Hi.
you. I just want to say a big thank you for PACES membership to bring this topic up. I think one of the things that we have recognized as PACES joined the Bureau and the other standing committee meeting agenda is that we really want to make sure we have a PACES member on all of our education work groups to ensure that we cover pediatric topics. So we really appreciate members of this group working with our education committee to update that slide set. And moving forward, we want to make sure anytime we have a work group that is formed that we include members from PACES. So again, thank you for working on this.
Thank you, Dr. Bradley. Appreciate the comments and the support of the committee. Our next item is we wanted to discuss the findings from the Pediatric Behavioral Health Work Group. For the benefit of the new members, we have essentially created a couple of breakout work groups to work on individual projects. The Pediatric Behavioral Health Work Group has now met twice, and it's been fact-finding. I'm wondering if I have anybody on the call today who sat in on the next meeting and would like to make comments.
This is Mickey. I can comment.
I was going to say, right. I was going to say, I thought Mickey was.
Yeah. So we've met. We're trying to help out with behavioral health and the EMS community on caring for these behavioral health patients, trying to get some ideas from other states, other entities. We know we don't have enough behavioral health facilities, but that's not the purpose of the committee to invent them, but it's more like to give education to the EMS community on how to care for behavioral health patients. So we've met twice, and Adam has done a great PowerPoint, and we're working on the PowerPoint.
Reach out to Adam, or maybe in the final announcements for this meeting, Adam, you can let the whole group know when our next meeting will be.
Right. Yeah, we are absolutely still trying to coordinate the next behavioral health work group. Where we left off last time, for the most part, was we identified the fact that we had a very limited picture of the behavioral health system so what I did was I took a look at Southern Arizona to represent kind of as a bit of a model. And so instead of chasing down a bunch of different facilities around the state, I just chose to focus in one area. And kind of what we figured out in that work group is that there is a lot of little patches of things that help in the behavioral health system. There's particular teams that are intrinsic to certain departments. Civilian Assistance Program, for example, from Northwest Fire District in Tucson, and they are a specific team that the first responders can call out at any time. And so that's an example of some of these small patchworks of these systems. And so what we identified that we needed was a comprehensive, overarching view of behavioral health in Southern Arizona. So that we can, not specifically, so I'm sorry, just I was using that as a reference, an overarching view of the behavioral health system so that we can deliver these pediatric behavioral health patients to the correct facilities. And interestingly, we found that a couple of agencies, at least in Southern Arizona, can indeed and do transport directly to behavioral health facilities. So having said that, it looks like we have quite a bit of information we need to discover and quite a bit of networking to get the right people to help us out with this project. As of yet, we haven't identified an exact object for us to kind of go after, but we did find, I think we discovered what we didn't know, and I think that's important.
Hi, this is Debbie. Can I ask a question? Hey, Adam,
Yes, ma'am.
Is it behavioral health hospitals that you're interested in reaching out to? Is that what you're trying to identify in terms of?
Yeah, absolutely. I would say that we could use the input from anybody involved in that system, and a behavioral health hospital would be an absolute wonderful. To have them represented in an accurate way would be wonderful, because that would allow us to ask questions that otherwise we would have to search down. So yeah, absolutely.
Let's connect offline, because we have a very robust behavioral health constituency group. A lot of behavioral health hospitals are members, and so I can help make that connection.
Thank you. Okay, I will absolutely get with you offline. Thank you, Debbie.
Yeah, Debbie, I second that. Thank you very much. Some of this has been kind of working backwards. I think we can all appreciate that behavioral health care has been a burden to the emergency services, and that the emergency department is not always the ideal location to care for these individuals. In fact, very often it's not. So in order to identify efforts and projects that this committee could work on, it really has been that issue of getting the right people at the table and doing the fact finding to just identify, what are those elements that can be created, whether they be education or fact finding in identifying where we can have an impact as a committee here, and advising to the other statutory committees in the Bureau. So all the input and help would be very helpful. And Debbie, if you have any specific contacts, that would be great.
Yeah, I will get with Adam.
Okay.
Excellent. Thank you.
All right. And I'm biting my tongue here, because Adam identified some really interesting NEMSIS data he's going to present to you guys later. So we're going to kind of hold on to that topic of behavioral health, and I think lend to it when he does present some information he did find. But just for the best interest of time, I'll take us to our next agenda item, item 6D. Last meeting, it was proposed that we would create another work group, and that was a work group to identify training gaps which could be the impetus or the foundation to starting new projects through PACES. Being that it's parliamentary processing, that motion or idea came up at our last meeting. So this meeting, we are going to address that by further discussing and then ultimately amending and or approving the creation of another work group. And I hope I'm doing that correctly as far as processing is concerned. So in that, we would like to form another work group, and that's a work group to focus on training gaps. Do we have any further discussion within the committee about the creation of such work group?
Is this is this a question? I'm sorry. My question is the work group just to stand, just to be stood up when we do find something to come across, when we do find a gap topic that we can work on it immediately? Is that the idea, Dr. Woolridge?
That was my understanding, but again,
okay.
It's open discussion.
Okay, it wasn't a specific topic that this work group. It was an overarching just to have a work group in place when we do indeed find something to work on.
Correct. Yeah. So my thought was that we create a work group that is going to identify a certain list of items or projects the PACES could work on moving forward. We bring that back to the PACES group for a vote to initiate that project.
This is Julia. Can I just hop in? I think this might have remained on the agenda because nobody volunteered thus far for the work group.
Okay.
So we wanted to see if that was still something that the group is interested in pursuing, or if that's just something that we should place on hold.
Okay.
Thank you, Julia.
But that being said, but we still do have to ultimately vote to create it as far as processing is concerned.
Well, it was approved at the last group, so we already discussed this and approved the creation of a work group, but nobody volunteered for the work group, so we don't have anybody on the work group, if that makes sense. So we've already approved it.
Okay. So not discuss, amend, approve. We're going to recruit volunteers.
Yeah.
My apologies. I haven't gotten the precision of Shelley yet, so I'm still learning here.
Okay. So that being said, I appreciate the clarification. So understanding what this committee or the subgroup is going to be doing is, again, it's a lot of it's exploratory. You know, what are the things that PACES could work on to help the Bureau, to help deliver pediatric care? And as Dr. Bradley had said earlier, as we interface with the other statutory committees, what can we assist them with, whether it be reviewing protocols, algorithms, adding that pediatric input? This would be essentially a committee that I would like to see create a short list of the things that PACES needs to be putting on the docket going forward. Who would like to participate in this training gap subgroup?
Dr. Woolridge, I'll volunteer for that.
Tony, thank you. And I'm sorry, Jordana.
I would like to as well.
Wonderful.
Zeidler, I'll be happy to.
Great. Thank you. Okay. Anybody else who may be interested and or we didn't hear because of a mic issue, please reach out to Adam separately and we'll get that list started and he will start working on a scheduling process to get it set up for our next meeting to do that.
I'm happy to help as well, Adam, if you need more people.
Absolutely. Thank you.
Thank you. Okay.
I think that is going to blend into item G with all this kind of data we had to go over. So, but we'll get there when we get there. I apologize. I mean, jump too far ahead.
Okay. I'm going to step us to our next item, item 6E, and that's to accept nominations and approve vice chair. This is a continued item that was in our last meeting. We have not had a volunteer yet. And I think the pretense to the position is strength in numbers. Someone who would work with me in that chair position to help facilitate productivity. Do we have anybody who would be interested in that role? And I don't want to put anybody on the spot. So if you want to mull it over and think about it, then you can also reach out to Adam separately.
Yeah,
and
absolutely.
we'll make that communication. And, you know, if you're exploring it and you're like wondering what the role might be, reach out to me, drop me an email, and we can kind of discuss how best we can dovetail efforts. So it's very much a team effort. So so either reach out to myself and Adam, and we can kind of bounce some ideas. Thank you. Item 6F, Education Committee Maternal Resuscitation Work Group. Adam, would you like to talk about that?
Sure. So the Education Committee approached me to be a member on a work group for maternal resuscitation. They identified that as a topic that they wanted to attack. And so we put together about 40 slides worth of maternal resuscitation information. And to be clear, it's not that this has nothing to do with postpartum or neonate care. This is all leading up to that. And so they felt it was necessary to kind of develop a slide set that was specific about the resuscitation. And really what they wanted to do is keep in mind all the changes that occurred during this process and how providers can use that information to better help these patients. And so I think it's pretty comprehensive. We had some really great people on that work group, and this is the product, and this is one of the products that was approved earlier today at the education meeting.
Wonderful.
So we think it's going to be another good tool for us if anybody has any questions.
Yeah, thank you for that, Adam. You know, this is a good example of, you know, how we can interface. I mean, the acronym for our group is Pediatric Advisory Committee for EMS. So when it comes to pediatric-related input on different items, now granted, it's not, this one's not pediatric specific, but it's areas in which we can, you know, cooperate with each other. Again, as Dr. Bradley had emphasized earlier, is that having the committees interface to be able to combine efforts is helpful. Now, I went through the slide set and I'm thinking, okay, and this is the pediatrician in me. It's I'm like, okay, what about the kid? What about the kid? So I'm already thinking that, you know, maybe we can have some educational items that would dovetail with this one. But all being said, I think it's a great slide set. Now, Adam, is this still embargoed, or is it possible that you could share it with us as maybe as a non-editable PDF?
Yeah, we do need to put it kind of manipulate it a little bit, but we'll get that out to you very quickly.
Yeah, I think it's let alone it's just educational. So
right. Okay.
Thank you for sharing that.
I do have one question, if I may ask.
Please.
The slide decks that we have approved in the education, like the baby back and now the pediatric naloxone, where do those slide decks live if we want to refer others to these?
We are working on having, I don't want to say redesign the website because that's a little too far beyond sorry, Gail, do you want to, Dr. Bradley?
You know, maybe what we can do is we can put a link in the chat to kind of tell you as how to get there. It is a few clicks in on our main Bureau webpage, so we are hoping to kind of clean that up a little bit, but in the interim, we can put a link in the chat. That way, if you want to look at any of our educational curriculums, you can quickly go to those.
Thank you very much. That'd be very helpful.
Yeah, if you go to the Bureau, Tony, in the educational section, you'll see some of the products that this committee has kind of put together alongside some of the other educational tools and components that are out there. There's videos, there's slide decks, and each of them are compatible for the individual agency to take out and use it as kind of the basis to their own CE if they want it. So I think it's a great service that the Bureau has. So please check it out when you get the link.
Thank you. I will do that.
And item G, I think that's you again, Adam, if you don't mind. Discuss Arizona short report methodology. This is the one I had alluded to.
So this came to us from a company called Image Trend, and they put together this. It's seemingly just perfect timing, and it's fantastic information. But we just wanted to bring it in front of the council to have it looked at and get some extra eyes on it and see what kind of information is important to us. What is some of the things we can pull from it, and what we can use it for.
So Image Trend essentially used NEMSIS data to kind of put some of this information forward. I'm sure they probably didn't just do it for Arizona, but this is kind of the Arizona report. Right there on this slide here really has kind of the bullet, real good take-home points. And Adam, stop me if I'm stepping on your toes here.
No, not at all. No. Please talk as much as you'd like.
Yeah, well, so it looks at the trends and essentially the strain that behavioral health patients is putting on the emergency services. 12% of Arizona emergent pediatric incidents were behavioral health related. That's a pretty good sized chunk. As far as the distribution is concerned, 26% of all Arizona pediatric behavioral health incidents were related to suicide or self-harm. You know, in the emergency department I work in, I'm lucky in that I'm a tertiary care center. I have we have social workers available. We have a psychiatric team who can come in on the day-to-day events. But otherwise, we're, even as a tertiary hospital, we're stuck in the same position of boarding patients without really having that psychiatric expertise. So, I think it illustrates it's a great setup to illustrate kind of the gravity of the problem. And then the one thing I really liked about this report, and again, I'm sorry, Adam, if I'm stepping on your toes here, is on page 5, further questions to consider. And I'd like to see everybody on our behavioral health subgroup to take a snapshot of that pink box right there. I think it really kind of gives us a summary of some of the strategies we can think about as we want to work on, again, this big problem, 12% of all pediatric emergency EMS transport cases.
Really quickly, like to invite Ann Vosbrink, who is our EMS Data Administrator, to give a little bit more background on the reports. And just she can shed some more light on where the data comes from. And yeah, so Anne, I'm going to toss it to you really fast.
Okay, thank you. So as Adam mentioned, this report was produced by Image Trend, which is actually, as many of you know, we have an EMS registry called AZ Peers that contains all of our Arizona EMS data that's submitted to us. And our vendor is Image Trend. So they happen to be the vendor of almost all states. Most states have a statewide vendor. And so any of those states who want to participate in this project can sign up. And most of the states are signed up, and they'll take that data and they will use it to do an Arizona specific report and then compare it nationally to all of those other states as an aggregate. It's pre-going to NEMSIS because it includes a lot more granularity than what we send to NEMSIS. So it isn't something that there's a NEMSIS data cube on the site that's a public data cube, but you wouldn't be able to get this level out of most of that. And I mean, I've read through it and kind of looked at what they've done, and I thought it looked really great, but you guys are the experts on PEDS.
Thank you, Ann. Other Ann, I'm sorry, and Stafford, to answer your question, I think that's what we were going to discuss is if this is something we could distribute, and I'll defer to somebody who knows whether or not we can distribute this or what we can do with that.
You mean as far as Adam? You mean as far as the report itself? Is it a published?
Yeah, I mean, is it are we at liberty to share this report with hospitals and the like?
I see nothing on there to suggest it's embargo, but I don't know if it's actually public.
Okay.
This is sorry, this is Ann again. So just because this is a relationship between my registry is the only reason I know about this part. Yes, we're absolutely welcome to share it. That's part of the advantage to joining up with this program with our vendor is we can use it or not use it as we see fit.
Okay.
I don't know if we can pull pieces from it without their permission, but I know we could publish the entire report someplace.
Yeah, the intellectual property, as long as it's appropriately cited and not edited or altered. And Safford, to answer your question, I didn't want to throw Adam under the bus. It's in your agenda packet.
Okay, great. We'll send it out.
Yeah.
Thank you.
Yeah, 'cause I was going to say the cat's already out of the bag. Okay. Moving on to our next item. The item H, discuss pediatric section of regional EMS education and workforce assessments.
So this is part of a larger survey. This is just the pediatric snapshot of it. It's not very long at all. It's only a few slides, but some of the notable things to mention about it is some of the limitations of the survey, which should be considered when we're thinking about how much or little to use this. But one of the major limitations was sample size, and the 164 EMCTs who responded represents less than 1% of the state's EMCTs, and so keep that in mind. Despite that, I think that it's still accurate. It's still accurately, I don't want to say accurately, but it still does a good job at reflecting common themes amongst pediatrics, and that's evidence that I can say that by this first box here, where this is true across the board most of the time. Less than 10% of the calls are pediatric calls, and so when I see that number, it kind of gives me some small sense of validity despite the sample size. And so this was a workforce assessment, and again, this is the pediatric component of that. So just some kind of basic questions posed to these EMCTs about their pediatric goings on. This is training they've received in the past 2 years. It makes sense that PALS is the highest one because that's usually it's required. Behind that, pediatric assessment, and then on down you see the percentages that they responded. This is a check all that applies, so those numbers aren't going to add up. The number of MCTs aren't going to add up to that 160 that was earlier mentioned. This is many selections that they'd like. And again, I think it gives this survey a little bit of validity because pediatric resuscitation, pediatric trauma, IO insertion, airway control, these are all very top topics when you ask the MCTs what do they want to know more about with respect to pediatric patients. So again, I think it's a good report for developing training. I believe these were click all that apply. These were not the ability to write in. I think these were they were click boxes, and you see the top 3 responses that the surveyed EMCTs responded with is those on the upper left. And then lastly, there was a section in the survey for them to write comments, and these are some of the ones that we found, which are fantastic. Some of these are good ideas. And so overall, I think this document allows us to target, between this this document and the image trend, I think we have some great ammunition to exercise that work group for. Did anybody have any questions about this assessment, workforce needs assessment? Okay. Dr. Woolridge?
Well, I mean, just, I feel like sometimes I get on my soapbox. When you look at the overall number of pediatric transports, it's much lower compared to adult transports. The argument being is that, the things you do more frequently are the things you probably don't need to be trained on regularly. If it's something you see only a couple times a year, how are you going to get that motor memory? How are you going to get that snapshot? The snapshot approach of bringing back that strategy of rescuing a kid, unless you do simulation, unless you do training. So I think all the more for the low frequency events, that's where the training, I think, is most valuable, because in general, EMS does a whole lot more adult transport. So, if you put the numbers of pediatric advanced life support compared to how many are adult, life support trained, and it seems like the pediatric training kind of falls lower in general. But again, my argument is we should probably do more training because those events are less frequent. So again, I get on my soapbox when I look at these things, but it just gives us more motive to be able to create more products and trainings that can be put out there for better access by particularly even the smaller agencies. So I appreciate the information, Adam, and you sharing that.
Sure thing. Okay.
So that ends our discussion of action items. Next on the agenda would be to consider items for our next meeting, and this is open mic to the group. Does anyone have any items that they would like to be added to the agenda for our next meeting, which will be in July? Mull it over, and if you guys have any ideas, please email Adam, and he can get those on the agenda for the next meeting. I think he needs to have that information a couple weeks in advance, but you got some time. So please reach out to Adam, and he can add those agenda issues for you. Next on our agenda is a call to the public. Any comments or announcements from the public? Anybody on the phone? Did anybody go to the Pediatric Symposium in Flagstaff? How'd it go?
Oh, sorry. Were you asking me, Dr. Woolridge? It went well. I think we did identify we needed some sort of representation in terms of a banner, which I have sent emails off. We did get approval to spend some grant money on a banner for the front of our table, so people know that we are the Department of Health Services with EMSC. So we identified that we need that. But otherwise, the Northern Arizona EMS was the greatest amount of respondents on our various surveys. So we were really happy to be there, and we have a great score. And so it was a great time.
Yeah. If you get a chance, educational events in the more rural parts of Arizona are extraordinarily valuable for the people who can't necessarily get to the urban sites as readily. So I'm always excited to see that the fact that symposium has remained annual, and it's been going on for goodness a while, maybe 10 years. So I go to it each year and I enjoy it. So
Dr. Woolridge, I can add to that if you would like.
Please.
That was the 14th annual. So we did decrease the number of participants to less than 100 just due to COVID considerations. The dates for next year, I believe, are March 6th and 7th. It's going to be the Monday and Tuesday. So it is a little bit of a shift from that into the first week of March. It is greatly attended. There were 8 different pediatric simulations for people to attend on day 1, followed by day 2 of lectures. We had some amazing lectors, including Dr. Woolridge. So thank you for those who attended. It's very well received, and it was something that unfortunately I didn't realize until I was here for about 5 years, the quality of the education that was there. And so trying to get that promoted and trying to get people to attend, try to come up to Arizona, Flagstaff in, winter can be a little bit of a challenge. Usually people want to sneak away when it's really hot in Phoenix, but it's a beautiful venue and amazing educational opportunities.
Yeah, thanks, Tony. I do enjoy the event. And any announcements from Arizona AAP? You're bolstering your CE projects, I think.
Yeah, we don't have anything new to announce, but we are looking at, we've got a CEN, a CPN scheduled in the next coming months, and then we're trying to work on our next physician CME project.
Any other announcements from the public? Adam, would you mind doing item 9, upcoming events?
Sure. April 5th, Advanced Hazmat Life Support Provider Instructor that's down in Tucson. April 7th, Advanced Hazmat Life Support Radiological Incidents. I assume those are related. And June 9th, AEMS's 22nd Annual EMS Odyssey Conference to be attended virtually.
Also a very excellent conference.
Okay. Next meeting is on July 21st, same time.
Okay. Well, if there's no other comments from the group, we do appreciate everybody attending and participating, and hope to see you guys in our subgroups when we start setting those up. Please reach out to Adam regarding future agenda items or participation in the other projects that we had presented. And I thank you all.
Thank you, everybody.
Thank you.
Thank you.
Bye.